Thanks for the time.
The next question is about business and the economy, but it's something that's sort of a side issue of healthcare, which is something that affects everybody in this room. And as you know, when our economic troubles have increased, the ability for us to fund healthcare and for people to afford it may be more difficult. This goes to you first, Mr. Davis. Do either of you know personally anyone without health insurance or someone who has trouble paying health insurance? And if so, how has this influenced your thinking on the subject, if at all?
Good question. Yes, I do know somebody that came to me about a year ago and wanted to work on a campaign, a gentleman in his mid-20s. And we were talking about the arrangements, and he said, oh, by the way, can you provide health insurance? I said, well, we're not set up with that with the campaign. And I talked him through it in terms of getting health insurance. When I started doing medical research about 25 years ago, I've been involved in patient care nearly 20 years. I worked at an institution that, in a sense, as a physician there, I can focus on practicing medicine, and I'm separated from that. I'll see a patient who's concerned about whether the health insurance will cover it, and I say, well, if you go discuss that at the business office, I'm sure it'll be fine. And close to 100% of the time, they come back to see me and it's taken care of. But this particular individual, I said to him, well, what you want, and talked about some of his health background, and he was willing to share that with me. I said, what you want to look at is to get your own health insurance and consider getting a high deductible. He came back to me and said, yeah, I could get it for about $100 a month. And so what I did is I increased his salary more than that, and he was able to do that. But he didn't know about getting health insurance. You know, I hear this number tossed around, 47 million people who are uninsured in this country. And there's a lot of them that fall into the age group of 18 to 34 that feel that they don't want to spend the money on health insurance. And we do have a law, the 1986 Mankato law, which actually mandates emergent health care for anyone who shows up in a hospital, and that is the proper thing to do. But of that 47 million, a sizable portion of them are young people who consider themselves to be indestructible. They don't want to spend the money. There's a lot of people in that group that can actually afford health insurance. And there's also another group in there, when they put that money together, that are here illegally, illegal immigrants. So it is ideal that everyone in this country is covered by health insurance. But how we're going to do that, the devil's in the details. And the state of Massachusetts has had some problems with universal health coverage, and the states are laboratories. So for us to impose that at the national level, we really need to be careful what we're doing.
Thank you. Mr. Walz?
There's also another group, the single mother who's working 50 hours a week and trying to provide health care for her and her children. And Dr. Davis, again, very clearly, and at least it was clear, and it was spoken truthfully, the same attitude that President Bush had. You don't have health care, use the emergency room. That's bad economics. That's bad policy because it costs more, it doesn't focus on preventative care, and it doesn't move us any closer to making sure we're a healthier nation. I know many people, and many of them are working people that don't have the ability to do that. Now, we're very blessed in Minnesota that we have Minnesota Care. We're very blessed here that we also have regulations that require insurance companies to cover certain things. We had a debate last night, and Dr. Davis has publicly stated that he thinks it's wrong for the state to mandate insurance companies to cover certain things. In Minnesota, that includes mammograms. And I asked the people, the women of Minnesota, how do they think about that if we should let insurance companies make the decision, oh, we don't cover your mammogram? That doesn't make any sense. We also have people, I'll tell you, who doesn't have health care, is under the administration through 2000, 2006, Priority 8 veterans. When they couldn't balance the veterans budget, they kicked out Priority 8 veterans. You want to know what a Priority 8 veteran is? Somebody making $29,400 in this district. That could be a Vietnam veteran. They couldn't use health care at the VA. But yet we're arguing for tax cuts to those making $200 and $300 million. It makes no sense. Our priorities are out of whack. I would argue what you're seeing here is you're seeing a fundamental difference. Healthcare as a right, as a moral right, also as good economic policy, and healthcare as a commodity to be traded and paid at the highest cost. Those who can't afford it are left out. Those who can, I wouldn't deny, they get the best care possible. If you can get to the Mayo Clinic, you're going to get good care. If you can't, and you're not an illegal immigrant, or you're not choosing not to be covered, you're still without health care. It's simply unconscionable in this country.
Thank you, Mr. Walz. Mr. Davis, you have a 1 minute rebuttal.
Well, of course, as a cancer physician, I know the value of mammograms. Mammograms save lives. They detect breast cancer early. It's not an issue of individual coverage, however. If you look across the 50 states, and there are organizations in this state that have charts of it, You'll have Minnesota that has the most mandates, Maryland has the second, and then on down the line. It would make a lot of sense if there was some uniformity in what are mandated things to cover and what aren't, in a particular health insurance policy. The more that the state does that, the more that we take away choice. One thing that we need to preserve is that when somebody comes through the door to see me, they don't come through as a Republican or Democrat. They come through as somebody that needs help. And we need to be able to preserve that choice between choosing the physician, choosing the hospital, choosing the healthcare provider. I'm concerned that some of the plans that are out there are going to do that. Massachusetts has been having some problems with that. Of course, good preventative care is very important in this country. We can save money in the long run, and we do have facilities to do that.
Thank you, Mr. Davis.
Well, the one thing is they may not come through the door as Democrats or Republicans, but if they don't have health insurance, they don't come through your door. And the focus of this is that's exactly what we need to make sure we can get. There's no reason that this nation is paying twice as much as any industrialized nation and getting quality that's lower. The Mayo Clinic, the institution Dr. Davis worked for, has a very clear plan, one that I support very clearly, focusing on, first of all, getting everyone covered, and then secondly, focusing on the things that we need to make sure are there. The value in this, making sure the Mayo Clinic delivers the highest quality of care for the least amount of cost. That's good business. We created a system, though, whether it be the insurance companies, whether it be the drug companies, or whatever, that is simply incentivizing seeing people more, charging higher prices, and not getting the outcomes we need. We need to be outcome-focused based, but we need to understand, until we get people covered on this, we're still going to have those problems of expensive care at the emergency room. We're still going to see mothers choosing between buying the diapers or treating the earache. That's simply not acceptable.
Thank you, Mr. Walz. We'll move on to the next question.